So today we're going to talk about physical activity and why it is so important for your overall wellness and your health, especially the health of your heart. My name is Kathy Stover, and I am a physical therapist, and we're going to have some great information to share with you today. So a lot of studies have been done on physical activity and physical inactivity, and it's interesting that now a lot of the science is showing that physical inactivity poses a great health risk to Americans. So this is important because it is just as important as keeping your blood pressure under control, which your physician can give you a pill for that. You want to make sure that you are keeping your cholesterol levels where they need to be. You can take a pill for that, a statin or something like that. Um, and so you have pills for some of these things. There is no pill for exercise or activity. It's something that you need to do, and you need to do in a healthy dose of it. And we'll talk a lot more about that in a little bit. So inactivity actually increases your chances for developing diabetes or even certain types of cancer, especially colon cancer. And it increases your risk of a heart attack or stroke. So physical activity is an essential protective mechanism in overall health. So an additional body of research has now shown that physical inactivity or lack of exercise is now considered the fourth primary modifiable heart disease risk factor, along with, of course, quitting smoking, controlling your high blood pressure, and controlling your cholesterol levels. So it is the fourth modifiable primary risk factor and is equally as important as the other three risk factors. So this says, "Oh wise one, what should be our main goal in life?" He says physical fitness. So should physical fitness be your main goal in life? Not necessarily. Physical fitness should be an important part of your life, but your main goal in life is very much your own individual uh, core goal. It may be to be able to garden. Maybe your main goal in life is to be able to live to see your grandchildren get married, or your main goal in life is to retire and travel around to national parks. Whatever your main goal in life, it does not necessarily mean it needs to be physical fitness, but physical fitness should be a integral part of your life. So we come to the question of, are some of the things that we notice as we get older just the process of aging itself, or does it relate to physical activity at all? And so again, research has shown us that physical inactivity helps to decrease your overall cardiovascular fitness. So not being active, your cardiovascular fitness will go downhill, and that just means that your muscles aren't using energy, you're not being very efficient metabolizing oxygen, and so you get fatigued or short of breath more often as you get older. And that not necessarily because of your age, but more so because of your physical inactivity. Inactivity also causes a decrease in your muscle mass, in your lean muscle mass. And this is important because lean muscle mass is what helps to burn calories, and it helps you become efficient in oxidizing or taking up oxygen. It helps with that. Inactivity also contributes to a decrease in strength and a decrease in flexibility. If you're not moving around or moving and stretching, then you're going to lose some flexibility. If you used to be able to touch your toes and now you can't, it's not because you're older, it's because you've stopped trying to touch your toes. Inactivity also can result in decrease in your bone mass. And this is very important because a decrease in your bone mass can lead to a thing called osteopenia, which just means that your bone mass is not at a normal level for your age. This can be serious because osteopenia can progress to be osteoporosis. And osteoporosis is where your bone density or your bone mass is not able to withstand the forces of gravity, and the bones become what people call brittle, and you run the risk of fractures. Inactivity also decreases your overall metabolic rate. So this is important as well because your metabolic rate is based on a lot of different things, but the overall metabolic rate is what helps you to burn calories and to stay at your normal weight. Inactivity also affects the quality of your sleep. So how many of you have ever worked with a young child and they have so much energy and you want them to take an afternoon nap? So what you do is you take them out and you let them run around and play outside and wear themselves down, and then they're able to take a lovely afternoon nap. Same thing with us. If we exercise and we burn some energy, we are more likely to be able to get to sleep at night and to stay asleep at night and to wake up in the morning more rested and feeling good. Physical inactivity also interferes with sexual performance and mental sharpness or mental performance. And the mental piece of this is important because blood flowing through the body and through the arteries within the brain, that blood flow and that sharing of oxygen and that kind of stuff, that helps your mental performance. And so that inactivity actually helps to decrease your mental performance. And that, of course, is a very sensitive topic as we do get older. So Hippocrates once said, "All parts of the body which have a function, if used in moderation and exercised in labors in which each is accustomed, become thereby healthy, well developed, and age more slowly. But if unused and left idle, they become liable to disease, defective in growth, and age more quickly." So we're going to talk about what types of physical activity we should be looking to do. And we're going to talk about each one of these individually and give you recommendations as far as the intensity and number of repetitions, etc., for each type of exercise. So the three main types are aerobic. This is where you're getting your heart rate up. Strength training, or anaerobic, where you're using weights or bands or whatnot, but not really necessarily getting your heart rate up. And then important exercise, which is stretching, which will help with your flexibility. So, first one is aerobic exercise. So this is where we want to get our heart rate up, and we want to try to shoot for 3 to 5 days per week at 60 to 70% of your target heart rate. And you want that to be at your rate of perceived exertion of moderate. And we're going to talk a little bit more about what these things mean. So ideally, 20 to 60 minutes, 3 to 5 times a day at 60 to 70% of your target heart rate with a rate of perceived exertion of moderate to slightly hard. And within our cardiac rehab program, you will be doing some of this particular type of exercise as part of your program. So activities may include walking, jogging, cycling, swimming, rowing, dancing, skating, anything that's getting your heart rate up counts as aerobic fitness, as long as you're getting it to 60 to 70% of your target and feeling moderate to slightly hard in your perceived exertion for that activity. So how do we calculate our heart rate zone? So our target heart rate is 220 minus your current age, and that would be your maximum heart rate. And you want to take that times 60%, and that'll tell you your target heart rate at 60% of your maximum or 70% of your maximum. And your cardiac rehab team will be able to tell you where they would like you to be at during your exercise. The Borg scale perceived exertion, excuse me, is a scale that we use here in cardiac rehab, and it's based on a scale from 6 to 20. So at 7 is pretty light, and at 11 you're kind of at light, at 13 you're at somewhat hard, and 15 you're kind of working hard, and at 17 very hard. So what we strive for in our program is for you to be doing something aerobic between 11 to 14 on the Borg scale. So somewhere between, light, somewhat hard, and approaching kind of hard. So exercise goals for strength training. So this is anaerobic. This is resistance training or weight training. And you want to try to get this in 2 to 3 days a week. And ideally, you would do 2 to 3 sets of 10 repetitions each with a rest period in between each set. And what we try to encourage people to do is to find a weight or a resistance level at which by the time you do 10 repetitions, you are fatigued. You feel pretty fatigued. You really would not want to do another repetition. Then you get a rest period and you're able to do another 10 repetitions. And at the end of those 10 repetitions at that particular weight or that particular resistance, you again feel pretty fatigued in that muscle. So we can use weight training or strength resistance training, free weights on weight machines, using elastic bands, or there are some equipment where you can actually use your own body weight as a resistance, usually on a platform. So why lift weights, or why do resistance training in addition to aerobic training? Because this is different. The aerobic training is targeting your heart muscle primarily. It does, and it has other benefits certainly, but this really, the resistance training and strength training is really focused on strengthening individual muscles or muscle groups. So it increases your strength, increases your mass, which makes you more metabolically efficient and helps you to burn calories. This also helps you to maintain or increase bone density. And this is, again, important to prevent the onset of osteoporosis. And it prevents limitations in performance of everyday tasks. So if we don't have the strength to lift a suitcase to go travel, or we don't have the strength to lift a bag of groceries from the floor to the countertop, or we don't have the strength to carry the wash basket to the washing machine, that is limiting our performance of just everyday tasks. So strengthening those muscles, strengthening all of those types of muscles, and strengthening the leg muscles to be able to go up and down stairs easily, that kind of stuff is what we get benefit out of resistance training. The last type of exercise is stretching, and stretching is designed purely to increase your flexibility. You want to try to stretch a minimum of 2 to 3 days per week, and I like for patients to hold each stretch for 30 seconds, doing 3 to 5 repetitions of each stretch. It's important to keep in mind when you are stretching to stretch to the point of mild discomfort, but you should not feel pain. And a lot of muscles, the bigger muscles to stretch a lot of times are the hamstrings, the muscles in the back of your legs, your quads, or the muscles in the front part of your upper thigh, your calves, and shoulders. So, there are all different types of sources for what uh, level of physical activity people should have for what benefit. So, the American Heart Association says that for general health, you should accumulate 30 minutes of moderate activity most or all days of the week. So that's 3 to 4 hours a week. Or accumulate 20 minutes of vigorous activity several days of the week, 2 to 3 hours a week. So either one of those counts for general health. But neither one of these regimes of 30 minutes of moderate activity, most or all days of the week, 3 to 4 hours a week, or the 20 minutes of vigorous activity, 2 to 3 hours a week. Neither of those will help with weight loss. So weight is an important part of our program, and decreasing your weight to a normal level will take a load off of your body, take a load off of your heart, and will decrease the effects of aging. So just losing weight to a normal weight actually improves the aging process. So it takes 3,500 calories to burn. You need to burn 3,500 calories to lose 1 pound. So this amount of activity is not going to be enough for weight loss to occur. But it is enough for general heart health, and this is a lot of times what we're shooting for within our program is general health. So you will need to keep this in mind, that you will probably need to burn more calories outside of our office on your own if you want to achieve weight loss. We also have other information on nutrition and how to uh, pick healthy choices in what you intake into your body, so that will also help you if you need to lose some weight. So for general health, all types of activities count, and so formal exercise, as long as it's of moderate activity, daily activities, um, as long as it's a moderate activity, and of course most forms of sports and recreation. And physical activity makes you feel better. So it gives you more energy and less fatigue. So you feel like I'm expending energy, and I feel kind of tired after I work out, and I'm kind of exhausted from working out. But you recover, and that recovery period is what gives you more energy, because every time you are expending your energy on exercise, you have a recovery period when you're not exercising, and your body is repairing and getting stronger each and every recovery period. So over time, you're able to do more with less fatigue. It also helps people cope with stress. It's a great way to kind of work out some extra energy feeling from your stress, and it also improves your self-image. When you work out, you get done with your workout, you feel good, you feel toned, you feel like you've done something, you feel good about yourself. And interestingly enough, it improves damage caused to the heart from coronary artery disease. So it actually can halt coronary artery lesions, and actually in some cases reverse the damage. And as we talked about before, it helps you fall asleep more quickly and to sleep well and sleep soundly through the night. And it also is a great way to share an activity with friends or family, or with a pet, or to make new friends. So you can make it social. It can be a social, fun type of exercise. So we talked about exercise for general health, which is general heart health through the American Heart Association, moderate amount of exercise, 3 to 4 days a week for 30 minutes. That is not going to help you lose weight if that is one of your core goals. So if we kind of bump this up a little bit, so we're going to look at vigorous exercise. So this is vigorous exercise is where you are getting short of breath, you're really pushing yourself. If you burn 400 kilocalories a week, that will help to improve your cardiorespiratory fitness faster than 30 minutes of moderate activity 3 to 4 days a week. At 1,500 kilocalories a week of energy expenditure, you can actually halt the progression of coronary atherosclerotic lesions, heart lesions. And at 2,200 kilocalories, now that is kind of running, almost jogging week of energy expenditure, you can actually reverse coronary damage. And this is not what we will do to you in cardiac rehab. Set the treadmill for 30 minutes at 5 miles per hour, monitor your distance and heart rate. We will monitor your distance and heart rates, but you will not be screaming for mercy. So we talked about what do we need to do for our general heart health? What do we need to do if we want to reduce our atherosclerotic lesions or cardiac lesions, coronary artery disease, stop the progression of that? Now we're going to talk about what do we need to do to actually lose some weight. Remember, we need to burn 3,500 calories in order to lose 1 pound. So we have to accumulate 60 minutes of moderate activity, most or all days of the week. So 5 to 7 hours a week of moderate activity. And again, all types of activities count, but they all have to be of moderate intensity. So a formal exercise program where you're going to the gym or doing a step class or doing some type of formal exercise class. Your daily activities of moderate intensity, though. A lot of sports and recreation activities. And if you add in your resistance training, you can count those minutes towards part of your 60 minutes. So your resistance training, those are your weights and bands. That amount of time that you do that training counts towards your 60 minutes of moderate activity. So benefit related to calories. So 60 minutes for most people, depending on your weight, they would burn 400 to 500 kilocalories per day and 2,000 to 2,800 kilocalories per week. So that's moderate intensity for 5 to 7 hours a week in order for weight loss to occur. So remember, physical activity makes you look better. It reshapes the body. It tones up muscles and burns fat. And when I say burns fat, it doesn't mean that the fat goes away. So muscles do tone up, but fat is always going to be there. The fat cells are always in your body, and they are distributed based on your genetic makeup. And so when you see people that are overweight and you see fat, that is the body is storing fat within the cells and they expand and get bigger. And so when I say burns fat, it's basically the exercise is making the fat cells shrink. They still exist unless you have liposuction. They're still there, but they're not expanded full of fat. They have reduced their size, and so that's what I mean when I say burning fat. Exercise increases your metabolic efficiency, and that helps you burn calories. If you need to lose weight, it helps you burn calories. And it helps to promote fat loss, which again, you're not losing fat, you're shrinking the fat cells, and improves your lean body mass, which helps you burn calories. So here are some examples of weight training exercises. On the left-hand side, you have a gentleman doing bicep curls, so the front part of your upper arm muscles. So he goes from the elbows extended and he bends them into his chest and then returns back to a straight position. On the right, this woman is doing a triceps press, and these can be done in different positions. This is one of the easier positions to do them in because your arms are at 90 degrees, they're not over your head. So she's from a bent elbow, and she just straightens her arms straight up into the air and then lowers them back down. Now, remember, you don't need to work through the full range of motion to benefit from the exercise. So you can do a partial part of that range to make sure that you're not hurting your joints. Like if it hurts to go all the way out or all the way in, then limit it. Don't go quite all the way. And again, you don't have to go out and purchase weights. You can use a soup can as a hand weight or something along those lines. So here is a lower extremity weight training exercise. It's a seated long arc quad or seated knee extension. And so basically this person is they're sitting and they're just basically kicking their foot up into the air slowly and then lowering it back down slowly. And again, you don't have to do this through the full range of motion. If it hurts for you to extend your knee all the way straight, you can go just not to all the way straight, just a little bit of bend. And for resistance, you can use an ankle weight or a band, or if you have a pair of heavy boots, put on your boots and do your knee extensions. And here, this is a hamstring curl. So you could hold onto a chair or something stationary or a kitchen counter, something like that, for balance and support. And all you're doing is keeping your hips in a neutral position, and you are pulling your heel up to your back. And so, again, work through a range of motion that is comfortable, and you can use an ankle weight, resisted band, or again, wear a heavy boot to give you some resistance. So, this is similar, but now the similar position, but this is a stretch. So she's holding onto a chair for balance and support, and she's just gently pulling her foot towards her back and feeling a stretch in the front part of the thigh. You want to make sure to keep her hips neutral, meaning they're not going forward or backward, and you want to remember to stretch slowly, holding each stretch for 30 seconds, and you're going to do 3 to 5 repetitions of each stretch. So here is one way to do a simple hamstring stretch. So lying on your back with one knee bent, your foot flat on the table or on the floor or on the bed, you're going to place a towel, probably something long like a beach towel, under the arch of the opposite foot, and then slowly and gently pull the leg upward using the towel. And the thing here is you want to make sure that you keep that knee that is up in the air nice and straight. So you don't want the knee to bend. If your knee starts to bend, then lower the towel down to not as far of an angle up in the air. And again, you want to do this stretch very slowly, holding it for 30 seconds. You're going to do 3 to 5 on each leg. And here are two different kinds of calf stretches. The one on the left is with the knee is in a straight position. She's stretching her right leg, her right calf, and her right knee is in an extended position, and she's pushing into a wall just for support and allowing that to stretch. You want to make sure when you're doing these stretches that your heel is down on the ground, on the back leg that you are stretching. The person on the right is stretching a lower part of her calf, and in this particular stretch, both knees are bent, and you want to stretch till you you want to go down into the knee, bend your knee until you feel a stretch in the lower part of your back leg, in the lower part of the calf in your back leg. When the doctor said to walk 2 miles a day, he didn't mean between the TV and the refrigerator. Well, now you know. So we've talked about the importance of physical activity, why physical inactivity is a very bad thing to get a habit to get into. We want to get into being active and make that an integral part of our lives for many, many great reasons. So, talk about the mind-body connection, because the body uh, is telling us stuff all the time. And we need to understand and pay attention to our bodies and what our bodies are telling us. And so you'll hear us talk about the mind-body connection, and we have another educational session to show you specifically on this topic. But in general, the mind-body connection is just an inward focus, an inward directed focus where you're thinking and concentrating inside yourself, inside of your body. And it's not judgmental. You're just being aware of, where is my head in relative to my shoulders? Where are my shoulders relative to where my hips are? Am I relaxed? Am I guarding? Am I tensing my shoulders up? You're just aware of your body and what you're feeling and what your body is doing. And again, I'm saying feeling, I'm not thinking. I'm not putting a whole lot of thought into this. So if I say, oh, my head is forward of my shoulders, I'm not going, well, should my head be forward of my shoulders? Or maybe it shouldn't be forward of my shoulders, or maybe it should be behind my shoulders. No, we're just acknowledging that, hey, my head is where it is. Oh, I noticed that my head is, forward of my shoulders. So the mind-body connection is so important. And so we pay a lot of attention to how much effort we're putting into activities and to exercise, and we pay attention to our breathing and muscle sense. Are our muscles tight? Are we relaxed? Are they in a good position? And so the mind-body connection increases your ability to observe yourself from a different perspective. Again, not judgmental, but just an inward observation of what is going on within your body. So George Sheehan, who was a world-renowned runner, once said, "The body mirrors the mind and soul and is much more accessible than either." If you can become proficient at listening to your body, you will eventually hear from your whole self. So, we talked about all these fantastic things that come out of exercise, and exercise is so important, and it helps us to age with grace, and it helps us to maintain great weight and strong bones and muscles, and we're flexible, and we can do our activities of daily living. So why don't we exercise? Why is it so hard to stay compliant with an exercise program? And one of the main reasons is it takes time. It's voluntary. No one's holding a gun to your head saying you must exercise, and it's time consuming. So it's a choice. It's a conscious choice for you to make, and it also eats up some time. And I always try to encourage people to set aside time for exercise, and it becomes part of their schedule of their day. They schedule it into their day. And Edward Stanley once said a long time ago, "Those who think they have not time for bodily exercise, sooner or later have to find time for illness." So let's look at an overall lifestyle approach to exercise. If we look at exercise like it's, oh gosh, it's something I have to do, get it over with, I have to do this, it's a chore, then it's going to be really hard to stay compliant. But if you get to the point where you make it part of your life, when you don't do it, you don't exercise, or you don't get that activity that you're used to for a couple days in a row, you start missing it, and you start feeling, your body starts telling you, hey, I don't feel as good. I don't feel as great as I did when you were exercising. Your body's telling you, hey, you've now come to the point where this is a necessary part and a great, healthy, necessary part of your daily routine. And that's where we want to get to. Remember, doing something is going to be better than doing nothing at all. When we are exercising, we are going to shoot, and when you're in cardiac rehab, this is where we will have you exercising. We want to at least be at moderate intensity. And again, integrate this into your life and make it part and an important part of your daily routine. And focus on the process versus the outcome. And I can't emphasize this enough. Because of that, and they get focused on the outcome, and they're so focused on the outcome that, and they're not making it. But I can do this now, or I can do it with less shorter breath, or I can do it with less recovery time, or whatever that improvement is, and focus on that process. Still keep the outcome in your sights, of course, because you want to be focused on a core goal, but don't center all of your accomplishments based on that outcome. Center it on the process. So pay attention to the little bitty milestones. They feel little bitty, but they build up. Just like dripping drops of water in a bucket, it feels like you're not going to ever fill that bucket up. But as you keep putting drops of water in the bucket a little bit faster or a little bit more intense, hey, you start seeing that bucket starting to fill up. And eventually, our goal is to fill that bucket, and it gets full. So it's a gradual process, and it builds on itself. So exercise, you feel a little bit better, you're able to exercise more, you feel even better, and again and again and again. And eventually, it will become part of your daily life, and you will miss it when you're not able to do your daily exercise or your exercise for that week. And jumping to conclusions does not count as exercise. So again, you want to have your sights on the goal, but let the goal go and focus on how you're going to get there and your path. And that mind-body connection, paying attention to your body, not being judgmental of your body, being accepting of yourself and where you are and where your body is, you will be able to maximize both your performance of an activity and you will enjoy performing the activity. So, when exercise is done properly, it integrates your mind and body, it stops being something you have to do, and becomes something you want to do. It becomes part of you. And everyone is different. Everyone has their own core goals. But in the end, you got to make exercise your way of life.